here live. This is exciting. So this is the first time we've recorded live the Digital Healthcare Podcast. I finally pulled the trigger on the equipment, and I'm joined with a special guest, Gabriela Wilson. Thank you so much for being here, all the way from Evansville. We're excited. She's the past president of HIMSS Indiana Chapter, and she also works at University of Southern Indiana as the chair of Health Informatics and Information Management, and she's also an associate professor. And she has a whole host of backgrounds that we'll get into in the conversation. I want to go backwards at some point, but I want to start out with, you have as the profile of your LinkedIn, you're a health informatics wizard with bold ideas to improve people's lives. Can you add some additional words around that and how you frame your role?
I'm so happy to be here, Brian. Thank you so much for reaching out. And I guess LinkedIn is a big social network for professionals, and I wonder, how did you learn about me? And maybe this was it. I consider myself a health informatics wizard because I really am interested in learning more about health by analyzing data. And lots of people have access to lots of data, but it's how do you look at data that makes sense, to be able to analyze it and present it in a way that can improve people's lives. So to me, a wizard is someone who can make something, like one of my students said, magic. You make gold out of nothing.
That's right.
And that's why I'm like, it might be like you step into lots of data that makes no sense, and I try to find that sense out of the craziness that's around us.
Yeah, so let's step backwards then and kind of start with, when did digital health or informatics, however you want to frame it, when did that first pop onto your radar?
So I have a very interesting background, as you said, and I never saw myself as someone going into informatics because I graduated with an engineering degree in chemistry in Romania, and the career for me was clear. You're going to be in a factory making plastic bottles, and I could not see myself doing that, right? So when years ago, my husband and I, high school sweethearts, decided to leave the country and packed a suitcase and a few $100s and went to Belgium, and it wasn't easy for us, but we said we need education to continue our education. So I was always interested in these new disciplines that nobody knew about, that sounded, I want to say it, sexy. So I saw this molecular biology and biotechnology area, a master's, and I was like, let me try that. And I never touched a computer in my life until that moment. And I was fascinated by how you can use technology to actually look at molecules and design new drugs. And we taught ourselves how to use a computer first, and then programming and things like that. And informatics was computers to me at that time. Health informatics really got my attention when I worked in pharmaceutical industry, because I was doing drug design, designing models to predict toxicity or drug-drug interaction. And I was like, you design all these drugs that are great for people, but if you take them for a long time, they will have side effects. So to me, the health informatics aspect is actually understanding the effect of everything we try to do in medicine and pharmaceuticals, how they affect human life.
And how was, you talk about the computing coming into that scientific domain. How was it done previously? Was it purely manual, just test in a lab? Is that correct?
Yeah, so when I finished my master's and then I wanted to do a PhD in that field, my dream was, when I was younger, was to become a physician, a doctor, right? But I realized soon enough, thank God, that I couldn't stand blood, and I didn't like memorizing things. And to be able to go into School of Medicine in Romania at that time, it was highly competitive as everywhere else. And I realized, like, I don't like to memorize. To me, if I learn something, it has to make sense, right? I'm not going to memorize this. So I was like, I cannot become a doctor because but I still want to help people, right? To have healthier lives. And when I saw that opportunity for my master's, molecular biology and biotechnology, I was like, I want to be able to design the best blockbuster drug that will make me also rich and famous. Because when you're young, that's all you want, be rich and famous.
You want to change the world, right?
Yeah. And the more I was reading about science being done in the United States, I said, boy, they have these capabilities, this cool software that can do this and that, and so much money that goes into research. And I was sharing that with my husband, and my husband was like, well, do a PhD in the United States. So I applied and I started my PhD at the University of Houston in computational biochemistry. And I was doing just that, look at the enzyme in 3 dimensions and then with glasses and look at all these hydrogen bonds that you can disrupt to be able to stick a little molecule there that will have a therapeutic effect. And at the same time, I was working with molecular biologists and X-ray crystallography people to be able to solve another enzyme or test molecules. And I was fascinated by how much you can do when you work as a team, multidisciplinary team, and that I'm not going to be successful designing a new drug if I don't have the right molecular biologist who can test my molecules, or I don't have the right chemist who can actually make the molecules that my computer tells me that would be the best potential drugs, right? So technology played a huge role. I don't like Workbench. I appreciate it. I'm not, you have to have a passion, right? So for me, it was the computer and what you can do with models to predict things.
Yeah, I'm curious, when you were practicing, like you just mentioned, did you have aspirational goals that just weren't possible because of the limitations of the technology available? Because that's what I see now. I'm sure that it's obviously a different time and technology's advanced, but we're still kind of pushing the limits, running up against what's possible with the technology that's available.
It's easy for people to tell you this is not possible. I mean, it's much easier to say you cannot do it than you can do it. And I'm the opposite. When people tell me you cannot do it, this is when I know I have to push harder to demonstrate that it can be done.
Right.
So I remember I was a graduate student working on my PhD, and we had this crystallographer who was solving the structure of alanine racemase, right? And it's hard. It takes years to solve a structure like that. And we are like, let's wait until he finishes solving the structure and then we can design the drug based on the computation models. And I said, I'm not going to wait. So what I did, I kind of used what was available in highly similar in structure, and I built my own model. And don't tell me I have to wait until crystallography solves the problem. Right. So it's just an example, but is with everything. When I joined the industry, because I worked in pharmaceutical industry for a few years in drug delivery, I was the only computational chemist in that company. And this company was doing and still doing great. Lots of chemists who are learning from past molecules that they design. And when you synthesize a molecule and then you have to go through testing, and it can be in vivo, in vitro, and all of these things, it takes time and money. And at that time, computational tools were really just taking off. And pharma was looking for those people with highly specialized skills to be able to design or predict toxicity. And I was interested in that. So I was hired after graduation as a scientist. No postdoc. I said, I don't want to go through a postdoc. I don't need it.
School.
Done with school. And I joined this company that was a little smaller than other companies who wanted to get me as a postdoc. But I said, I feel if I joined this smaller company, I would have the opportunity to work with, not be one computational chemist among others, but actually be the only one who can work with a chemist, with a molecular biologist, with the executive team, why not? and have an impact. And it wasn't easy because I had to gain the trust of all these people. Like, who is this girl to tell us how to build our molecules? And you have to, of course, you build your models and everything, and you have to test them to show that what you predict actually is, has at least 85% prediction level, confidence level. So when I got to that level, I gained their trust, and then the chemists would be the ones coming to me and say, hey, we need your help with building a library, virtual library of millions of compounds based on these chemical groups. And that's powerful.
Right.
And you won't be able to do it without technology. I mean, to them, to build a group of class of molecules takes so much time.
Yeah. So because you had that multifaceted background, were you able to see things that others weren't? Just because I assume most people were in their silo, looking kind of purely in their silo.
Well, yeah, that's an advantage because the more you are exposed to different fields, and at that time I wasn't even dreaming about going into academia because I said academia is not for me. I want to be in pharma, and I told you, rich and famous. But I said I want to have, be able to have an impact. I was coming up with these ideas, and at the beginning, just being fresh from grad school, hired, you have to build your credibility, right? So I was fortunate enough to have a VP of Research and Development who really saw the value in me, and that, yes, I was looking at things in a very different way. And he gave me that, he empowered me to join board of directors meetings and present my ideas. And it was scary at the beginning, but then I was like, you know what? They want the best for the company, and I'm here not because I work for one person, but because I work for this company and I want the company to be successful.
So do you place more value, or is there more benefit on the science or the technology side, or is it having the blend of both that really differentiated you?
So when you ask this question in terms of being successful in a career, or just
how, from your perspective, did you value either one of them more, or was it purely having both
Well,
of them?
I will tell you that what I value most, and it's going to surprise you, my answer is yes, you have to know the science and you have to have the knowledge. But sometimes you cannot have both at the same level. So it has to be a combination. What I think one needs to have to be successful is also the vision, right? Because you might have the best tools at your hands. If you don't have a vision of what you can do with those tools, and you might not be the person who can do it, but to know there is a possibility and reach out to that individual or individuals who can actually help you get there, I think that's what it's important. And of course, you have to know the science, but we can't know all the answers to all questions, right? So science is very important. I can dig through literature and find my answers. But the most important skill to me in between, you can have best scientists or best technologists in the world if that person doesn't know how to marry this two.
Yeah, bridge the gap.
Right?
Yep.
Bridge the gap. So this is how I see it.
Yeah, so you mentioned briefly the importance of teams. Can you elaborate on that?
So I'll give you examples of teamwork because I learned both from industry and academia, and that's very important, how people look at teamwork. So when I was in industry, at the beginning, as I said, until you gain the credibility, it's very hard for people to trust your capabilities. And when you get to that level, they feel so comfortable with working together that it's so organic, right? So we are all interested in developing this molecule and being successful. And if you have stock, then I'm doing this because at the end of the month, I'm interested in getting some money back, right? But even if it's not that, it's a collective effort. And I'm not saying that all companies have the same organizational structure and strategy. And I was lucky. It was a small company, and this is how I saw it, and we worked amazingly well together. And then I moved to academia, right? So academic institutions, research institutions, because I was at 2 research institutions, are very competitive, because to be able to do research, you have to apply for grants to get funding. And then you hire people for how long that grant is being funded. When that grant gets close to an end, that individual, if there is no clear path for what this individual is going to do, the money runs off, it's clear that individual is not going to stick around. And because of that, it becomes the threat. And as a result, if you're part of the team and you don't know what the future brings, you cannot give yourself 100% of what you know and what you can do, because you're like, what if they take it from me? So multidisciplinary teams are cool and sexy, but it takes so much effort and so much trust to be able to, and it has to be organic. I mean, the main thing is to trust each other.
Did you find that the expectations from leaders had a big impact in how the teams operated?
Absolutely. Because, oh boy, I'm dreaming of a wonderful leader one day that I will have. Maybe I am the one that I will build my team the way I want it. But if you don't have a leader who is capable in seeing talent in every individual as part of the team and what they can bring to the table, and not everybody, I like people who don't agree with me. I don't feel threatened by that. So if I have one member of my team who tells me, nope, Gabriela, you cannot do this, and then they argue, and I'm like, yeah, that's good, we're making progress. Well, they are leaders who don't like that. They don't like to be challenged. And this is when the project can go
haywire.
Yeah, exactly. Because it means that it doesn't matter what I think, they still gonna do whatever. Or the decision is gonna be made outside of the room, therefore why should I contribute?
Yeah, and I think it enabled. I just had a project where it was completely cross-functional in how we set up the team, and it ended up, we got to the best outcome because we enabled that transparency and open communication, just like you said, because ultimately you're trying to get to the best outcome if you're on a good team, right?
Yeah, so I started this in industry. It was the same. If we are not part, like feeling that we all work for the same, and it's always, I like Simon Sinek a lot. He's my, and find your why. Okay, it's really important. Why are you here? Yeah, because you care about this product. You care about your students. You care about patients. It's important. But if you lose the fact that we are here for this, but to make this successful, we have to take care of ourselves first, right? That's important because, I'm just here to do my job. I'm sorry.
Yeah, when you get in the room with someone like you, it doesn't
I'm just
match.
here to do my job. Okay, good. But I want to see you passionate and you want to work with the others, and you can be trusted and you trust the others. So yeah, I see this. I have projects with students and
Well, let's get into that. Talk about your transition from industry to academia. How did that play out?
As I said, I never imagined I would go to academia ever. I said I will be very successful in industry, and sometimes I have regrets that I moved to academia, but I immediately forget about this, because when I see the impact that I have on my students, that's the biggest reward I can ever have. In industry, you might have bonuses and more money and more this and more that, but impacting lives, it's the best thing and building a legacy, right? To have a student who writes me a card. And so how the transition happened, it wasn't planned. My husband
That's a common theme.
Gosh, yeah, so my husband got a job to a different state, and we had to move. And at that time, because we went through a 5-year of long distance marriage. He was in Belgium, I was in the United States doing my PhD, and then he moved to the United States, and I felt it was my time to give him a chance to do what he wants to do. So I said, okay, let's move. and we'll see. I'll find something. And in my mind, everybody needs a computational chemist, right? And they are pharmaceutical companies in Pennsylvania, in Pittsburgh. Not so many at that time. So the only thing that was available was, what about being a scientist in an academic research institution? So I started applying and I got a job. And as a scientist, you're not exposed to teaching or anything like that. But I got a wonderful opportunity to be an adjunct at Carnegie Mellon University and teach bioengineering. And I was in this auditorium with 150 students, and here I was in front of them like, oh my gosh, they're going to hate me. And it wasn't like that. And then to have them at the end and come say, hey, would you be able to explain to me, what about this, what about that? And then I started teaching more and more, like guest lectures on drug discovery. And when you're passionate about this field, they see it, the students. And this is when I said, maybe academia is for me. So that's how it happened.
Okay. And then, so you were at Carnegie Mellon and then?
University of Pittsburgh Medical School.
Okay.
And I was the pharmacoinformatics specialist there, which this is when they created this title that everybody thought, wow, my gosh, it sounds so fancy. What exactly are you doing? So I would try in very, very simple terms to explain, like almost the same I'm doing now with health informatics. Health what? Or informatics what? And what does it mean? And then you explain. But it was like a drug discovery computational chemist.
Okay. It seems like just when everyone gets comfortable with the term, we change it. Is that?
Well, like we talk about personalized medicine versus precision medicine, right?
Yeah, they're one and the same.
It's one and the same.
Yep. So as an educator, present day, how are you going about putting together your curriculum? What are you focusing on?
So this new program that you mentioned that I lead at University of Southern Indiana, this is 1 year. Oh boy, I don't even know if it's 1 year old. Maybe not. It was approved in March of 2017, which is not even. No, it is.
Yeah.
Right. We started in fall of 2017, so we're getting close to 1 year, right? Okay. This will be the second semester in spring when we offer classes. When I came to Evansville, again, my husband got a job there. And I told him, this is the last time I'm following you. Whatever happens from now, it's going to be on my terms. It's my turn. But I was interviewing for this position of assistant professor for health informatics. And again, I saw the title and it sounded really interesting. So I remember the day of the interview when I was talking to the search committee and I said, what do you want this person to do besides teaching? Well, what do you want to do? And I said, I want to build a program. And they were all like, good luck. And that was my goal from that day when I interviewed. And I started really looking at what's happening around me. And I know that, Indianapolis is Eli Lilly. Everybody knows about this. I had collaborators from University of Pittsburgh who consult for Eli Lilly. And I was like, there is so much opportunity to do something, academia and pharma and healthcare organization, hospitals. And I said, this is my chance. What am I going to do? So I started thinking about the program, knowing that in that region where we are, there are not so many opportunities and people don't want to travel to Indy. So I started connecting with people. I think what I learned was by joining HIMSS, the Health Information Management Society, I was able to be exposed to so many wonderful people, ideas, technologies. It's a huge organization, very diverse, not too many people from academia at that time. And I said, why not bring what the industry needs in terms of developing the workforce with the right skills? It has to be done in academia. There is no way you're going to hire people and hope that you're going to be able to train them after you hire. So they need the preparation. And that was my goal, that by building this program, I am going to build a curriculum based on what the industry needs. But the way I did it was also look at my students. So I like to use design thinking in everything I'm doing, which means you want to be successful as a healthcare organization, you have to put the patient first. You have to empathize with who you're going to design the services for. So I applied the same, and I took a certificate program with the University of Virginia, Darden School of Business on design thinking. And it was like industry related, right? But it's the same principle. You want to build a curriculum of a new program. Who is the person that is going to benefit? It's not for me or the faculty teaching. It's going to be for these students who have no idea first what health informatics means. And then this, when they graduate and after all the courses they've been taking, that you want them to be successful and get a job that it's hard to fill.
Right, right.
And there is a need now.
Yep.
I mean.
So is it a blend of technical skills and science skills? Is that accurate?
Yeah. So they start with a basic introduction to health informatics, and that's a prerequisite course for everything else, where they are being exposed to different areas of, people think health informatics or technology in healthcare is just electronic health records. It's not. It's a lot more than that. So through this course, they're being exposed to even social media in healthcare, the power of that, of collecting and analyzing data, to be able to prepare for an outbreak like influenza or whatever it is. It's about project management. It's about data mining and data analytics, electronic health record and health information exchange. Because if we all put all this data now using technology, it's like high throughput screening, the same concept. And that's why industry, to me, the experience I gained in industry really helped me designing this curriculum, because yes, we can now screen millions of compounds because we use the coolest technology ever and we screen millions. But how are you going to pick the best candidates to test in vitro or in vivo, right?
And how do you have the students even be able to have a conversation with the scientists? Because that's a hurdle that is tough for some folks to get over.
And it's again, I need the best software to help me do that. I understand, but if you don't have the scientific background of how you are going to funnel through all of your compounds, the ones that you really want to pursue, and it's looking at chemical groups, and it's so much more complicated. The same is in healthcare right now. Yes, we all have technology, we all put the data in EHR, but when it comes to analyzing, what are you looking for? What are you trying to improve? What problem are you trying to solve? You need that scientific and
you need that cross-functional background.
Exactly.
Yeah, I think that's actually one of what you touched on briefly, being so single focused. Like if you were to put together a program just focus on medical records or electronic medical records, you just lose so much value. Because if you look at that's one of the reasons I started the podcast, is I joined pharma pretty green and inexperienced, and I just think it's crazy that we have all these different pieces of healthcare and nobody talks to each other. And from what I've seen, there's a lot of folks that only want to focus on their one area, and it's going to be hard to change the industry if you only know one single piece of it.
Well, I tell my students when I talk about health informatics is, like, think about it. You have a credit card or an ATM, and you want to take money. And it doesn't matter where you go, which terminal you're going to use from which bank. Of course, they will charge you, but your information is there. So how come we see interoperability and all this information exchange in other businesses, and we cannot achieve this in healthcare? And the answer is easy, because we need standards in place, right? So that's what the industry is now focusing on establishing those standards so the information can be exchanged. And when we reach that level, I think it's going to be, it doesn't matter where you travel, it doesn't matter which hospital you go to, your information is there. I believe in personal health records, right? Like, it's my data, I own it. but listen, there is clinical data you don't have access to. And you probably don't even need to have access to, right?
Yeah.
But your specialist and your family doctor and someone else that takes care of you they need to have that information.
So when you're putting together the curriculum and you talked about syncing with the industry, are you trying to, would you say you're retroactively trying to build the skills that the industry needs, or are you trying to stay one step ahead of the industry? How do you think about that?
I think I'm trying to stay ahead to kind of predict what the future brings. So I'll give you an example of artificial intelligence, right? So we are not there yet, but I know Amazon is doing a lot lately. We're using Alexa maybe to be able to manage chronic conditions, remind you when to take your pills and all of these things. So I prepare my students for those times. I was able recently to acquire some robots that will be able to bring online students or face-to-face students in the online setting and vice versa, or a guest speaker who might be in Indianapolis. And we had the Health Informatics Conference that I organized. So October 24th, we had our 5th annual. And my students prepared presentations that were delivered via robots. And that's telehealth, telemedicine, right? And they were so excited. To make it even more interesting, I will tell you this, that this student or face-to-face students with online students who are enrolled in the same course online, and until the day of the conference, they had no idea that some of them were meeting with me face-to-face. And they were like, I thought we were all online, because they had that connection, right? So if you think about where are we heading, what are the skills that these people need to develop? I think it's communication using all these technologies, like virtual communication.
Mm-hmm. Mm-hmm.
That's important.
Yeah. Do you, I guess from what I've seen, I think if you compare healthcare to other industries, it still moves slower. But I guess I'm seeing the pace pick up, and I'm curious, do you see that as well? Having been in industry a lot longer than I have.
If you have more, if we would have more disruptors around us who would push for this, I think it will go faster. I am optimistic that this will move in the right direction and faster that we can predict. Because if you look at how technology advances, just look at the smart devices that are now being integrated in healthcare. And again, it's all question about privacy, security, and it's not because healthcare is a slow industry. It's because we have to be concerned about privacy and security, HIPAA regulations. There are lots of things that are much more than aviation or
retail
or things like that,
yeah.
right? So if someone hacks into the Target or whatever, okay, they will gain some information. But if they hack into a system in a healthcare organization, a hospital, and we're talking about even getting genetic information in there, can you imagine?
Or biomedical devices. That's
goodness,
scares
you can.
Me, yeah.
We talk a lot in my classes about ransomware and cyber attacks, and I ask my students, so what do you think will happen if someone will hack into a hospital? Or we can't enter data in the EHR. And I said, no, that's not it. What else? And it takes a while for them to start thinking that actually everything we do now, and it's not just healthcare, everything we do, even closing the garage door from an app, if someone hacks into your system, you're done.
Yep. Yeah, it's a little bit frightening, but also there's reason for optimism. But
it's opportunity for new jobs, and that's what I'm trying to explain. And, as you said, are you thinking forward? Yes, I do, because people like to think in the past or present. I want to think what the future brings. And one example is self-driving cars, right? So people are like, if we're going to have all self-driving cars, there will be no car insurance companies around. And I'm like, maybe. But then what if someone hacks into your car's computer and gets control of your car and you're going to be in an accident? You do need an insurance. The insurance is going to be through the cybersecurity. So you will need those students or individuals to have the proper skills to get those jobs.
Yep, absolutely. Talking about your students, what's the most common piece of advice you give them as they enter or as they graduate and move on?
I like, so before they are admitted in my program, I like to have a one-on-one conversation with them, and they have to also put a letter of why do they want to be in this program. And some of them know why, some of them don't. And when I talk to them, I said, what are you passionate about? And I'm not expecting to say health informatics. But if I hear that they are passionate about something, to me is a great indication that these people will be able to do whatever it takes to make it possible. So passion is one thing. Second, I want my students to be able, and we talk about technical skills and things like that. This is something that we can model, we can learn. And you can learn on a job sometimes, but this program is going to help you get there. But I also want for them to be able to never give up. Like, it doesn't matter how hard it is. And I tell them my stories. Like, it wasn't easy. You look at me now, but let me tell you. And then your life is not easy. But an end goal, this is what I want to do, right? And then be able to give to others. So if I give them an advice, and this is mostly towards graduation, is, okay, you made it here. You are helped along the way. Now is your turn.
Yep, that's great. And I think a great question to end on is, I want to get your perspective on, in terms of digital health, what excites you most about the future?
Well, and scares me too, right?
Loaded question. Yeah.
There are lots of new technologies that are coming. You look at wearable devices and how many things you can do. But again, who gets that data? Who is using that data to learn about you? And that's something that worries me. It's exciting to see all these new technologies coming. I'm looking at Alexa. I have one at home. And Alexa is silent most of the times, unless I want to listen to some Christmas music or the news, because it excites me that these devices now, these artificial intelligence-driven devices, can learn a lot about the user. And I think for healthcare is a great opportunity, because let's assume you are in you hear this complaint from physicians, like, I don't want to spend my time entering data in the computer. I want to be able to take care of the patient. And they're right. You need that personal connection when it's your health. So imagine to have a device like this that sits there in the room and captures all this conversation between physician and patient, and is being able to tell you, based on what Gabriela told us about her symptoms, Dr. So-and-so, what do you think about recommending some exercise along with some other therapeutic, and it doesn't have to be drugs. Sometimes it's easy just to reduce stress levels with virtual reality, and this is something I'm interested, because with one of my students, we developed virtual reality applications to reduce stress. So I think artificial intelligence is the biggest thing that excites me, but scares me also.
Yeah, that's fair. I think most of us who have even scratched the surface on artificial intelligence feel the same. It's both exciting and a little bit freaky and scary in some senses.
Well, I like the Terminator movies, right? And I asked my students, so have you guys watched this? And they say, yeah. And I say, who is Skynet? Who is behind Skynet? And it takes them a while to give me an answer. And I keep digging, and come on, guys, think about it. It's artificial intelligence, right? And this movie is such a long time ago.
Well, this has been amazing. I really appreciate getting the opportunity to interview you. I'm excited to see what you do next after hearing your story and where you're at now, and I'm sure the students are the ones that benefit the most. Any closing thoughts that you have?
Because we just had commencement last weekend, and I was so excited to see thank you cards from students and see them walk, and it brought tears to my eyes seeing them there, getting to that point. I keep telling all of my students, your success is my success. And also, don't forget, whatever job you land, you also represent me. Mm-hmm. So do a good job.
No pressure, right?
But I guess I'm trying to be the best role model I can be for my students. And as I was talking on our way here from Evansville, I have high standards. And if I have high standards for others, it means that I have those first for myself. So those are really wonderful values to have, and I hope that my students at least will get that from me.
Well, I've got to meet one of them, and I'm sure she would agree with everything you just said. So thank you again so much. And for those of you who like the podcast, the best thing you can do is tell a friend. We have some exciting news coming up that I don't want to announce just yet, but be on the lookout for that. And till next time, thanks everyone.